This is an historic day for our country.
With the pressure of a court deadline looming, the federal government has put forward a plan to change the way some Canadians will die. There's the question of how. First, there must be a written request from the patient, a medical opinion from 2 independent healthcare providers, and there is a 15-day waiting period, with possible exceptions for those who are close to death. A doctor or nurse practitioner can either administer a substance that causes death or prescribe it to patients to take themselves or with the help of a loved one.
It is about compassion in times of great emotion and grief.
But there's also plenty of focus on who is eligible. According to the proposed law, the person must be at least 18 and competent with a serious and incurable illness that causes enduring suffering. And here's perhaps the most contentious element. A doctor must determine that a natural death has become reasonably foreseeable. A group representing Canadian doctors applauds the plan, but says there's still more discussion needed.
So that we can make sure that physicians are very clear when a patient comes into their office. We all want to be consistent in trying to decide who qualifies and who doesn't.
But those who have pushed most forcefully for this are disappointed that the plan puts off discussion about whether some minors should qualify, as well as those suffering from only mental but not physical illness.
How is that not discriminating? It is.
There are other sensitive questions that under this plan would be left up ultimately to the provinces and territories, like whether whole institutions like faith-based hospitals can refuse to help a patient die. And for doctors who don't want to assist a patient with death, are they obligated to offer a referral? The Supreme Court's deadline for getting a new law in place is June 6th. Catherine Cullen, CBC News, Ottawa.